Good morning. This is Dr. Adel Bondok, Professor of Anatomy and Neuroscience, Mansoura University, Egypt. Today I will talk about the axillary and the brachial arteries. Okay, regarding the regions of the upper limb. This is arterial trunk. Okay, in the axilla, we have the axillary artery. In the arm, we have the brachial artery. In the forearm, we have the radial and the ulnar arteries. And in the hand, the ulnar artery continues as the superficial palmar arch, and the radial artery continues as the deep palmar arch. So in the hand, we have two palmar arches, superficial palmar arch and the deep palmar arch. Okay, reminding you that when talking about any artery, we should talk about the origin, where and how. We should talk about the termination, where it terminates and how it terminates, brief course or landmarks, and the branches. So let us start with the axillary artery according to these 4 points. So the origin of the axillary artery, this is the axillary artery or the arterial trunk. This is the first rib, pectoralis minor, and the teres major. So the origin of the axillary artery, it is the continuation of the subclavian artery at the outer border of the first rib, here. The termination here, at the lower border of teres major to continue as the brachial artery. So origin, continuation of subclavian artery at the outer border of the first rib, and the termination at the lower border of teres major to continue as brachial artery. The course is divided by pectoralis minor, this is pectoralis minor, into 3 parts. First part, above pectoralis minor. Second part, behind the pectoralis minor. And the third part, below pectoralis minor. First part, second part, and third part. Again, this is the axillary artery. Begins at the outer border of the first rib as the continuation of the subclavian artery, and terminates, okay, here is the origin, terminates at the lower border of teres major to continue as the brachial artery. The course is divided into 3 parts by pectoralis minor. First part above, second part behind the pectoralis minor, and the third part below pectoralis minor. According to the branches of the axillary artery, remember the rule of 1, 2, 3. The first part gives only 1 branch. The second part gives 2 branches. And the third part gives 3 branches. The first part gives superior thoracic artery to the intercostal muscles. The second part gives 2 branches, one along the upper border of pectoralis minor, thoracoacromial artery, and the other one along the lower border of pectoralis minor is the lateral thoracic artery. The thoracoacromial artery or acromiothoracic artery gives 4 branches, A, P, C, D. Acromial branch, pectoral branch, C, clavicular branch, and D, deltoid branch. Second branch is the lateral thoracic artery. So the second part gives thoracoacromial and the lateral thoracic artery. Thoracoacromial gives 4 branches, A, B, C, D. Acromial, pectoral to pectoralis major and minor, and clavicular branch, and the deltoid branch in the deltopectoral groove. Then the third part gives 3 branches, anterior circumflex humeral and posterior circumflex humeral arteries forming a circle around the surgical neck of the humerus, anastomosis around the surgical neck, and the subscapular artery, which gives circumflex scapular artery. Okay, this is pectoralis minor, this is the deltoid, pectoralis major, this is the deltoid, this is the deltopectoral groove, and this artery which pierces the clavipectoral fascia is the thoracoacromial artery. It gives 4 branches, A, B, C, D. Acromial branch is going to the acromion. Pectoral branch, okay, supplying pectoralis major and minor. Then clavicular branch to the subclavius. And then deltoid branch in the deltopectoral groove with the cephalic vein. Then we'll talk about anastomosis around the scapula. This is the scapula. I see 1, 2, 3 arteries, 3 major arteries forming anastomosis around the scapula, and we can add a 4th one. So arteries taking part in the anastomosis around the scapula are, this is the first one, suprascapular artery. Okay, 4 arteries. Suprascapular artery. This suprascapular artery is a branch from the thyrocervical trunk, which is a branch from the first part of the subclavian artery. So we have 4 arteries forming anastomosis around the scapula. The first one is the suprascapular artery, branch from the thyrocervical trunk, which is a branch from the first part of the subclavian artery. The second branch is this one, deep branch of transverse cervical artery. This transverse cervical artery is also a branch from the thyrocervical trunk, which is a branch from the first part of the subclavian artery. So we have 2 branches from the thyrocervical trunk, or we have 2 branches from the first part of the subclavian artery. The third artery, this one, which is the subscapular artery and its circumflex scapular branch, which arises from the third part of the axillary artery, and then posterior intercostal arteries. Okay, so the 3 major arteries, suprascapular, transverse cervical, subscapular, and this anastomosis connects the first part of the subclavian artery with the third part of the axillary artery. So the 4 arteries, suprascapular, transverse cervical, subscapular, and posterior intercostal arteries. So again, anastomosis around the scapula. 4 arteries, and then we'll talk about the importance. Suprascapular artery from the thyrocervical trunk, which is a branch from the first part of the subclavian artery. Second one, transverse cervical artery, which is a branch also from the thyrocervical trunk of the first part of the subclavian artery. The third branch, circumflex scapular artery from the subscapular artery of the third part of the axillary artery. This anastomosis connects the first part of the subclavian artery with the third part of the axillary artery, and it forms a collateral circulation in case of obstruction between the first part of the subclavian artery and the third part of the axillary artery. this is the brachial artery. Again, we'll talk about the origin, termination, landmarks, and the branches. So the origin, it is the continuation of the axillary artery at the lower border of teres major, and then the termination. Again, how and where. How it terminates? By dividing into two terminal branches, radial artery and ulnar artery, where opposite the neck of the radius. So origin, where, lower border of teres major, how, continuation of the axillary artery. Termination, where, opposite the neck of the radius, how, by dividing into radial and ulnar arteries. Then we'll talk about landmarks. The brachial artery is related to the biceps muscle and to the median nerve. So I will talk about relation between brachial artery and the biceps and the median nerve. We see here it is running along the medial border of the biceps, and in the cubital fossa it is medial to the tendon of the biceps. Then we'll talk about the branches, the 5 branches. So let us talk about the landmarks. So again, the origin, continuation of the axillary artery, termination here, opposite the neck of the radius, by dividing into radial and ulnar arteries. Landmarks. Okay. Relation to the biceps and the relation to the median nerve. So relation to the median nerve, it has triple relation. In the upper part here, the median nerve is lateral to the artery. In the middle part, the median nerve crosses anterior to the artery. And in the lower part, in the cubital fossa, the median nerve is medial to the brachial artery. So the median nerve has triple relation to the brachial artery. In the upper part, the nerve is lateral. In the middle part of the arm, the nerve is anterior. In the cubital fossa, the nerve is medial. Then the relation between the brachial artery and the tendon of the biceps, the brachial artery is medial to the tendon of the biceps. And this is very, very important, because that's where we can feel the pulsation of the brachial artery, medial to the tendon of the biceps. Then the 5 branches of the brachial artery. This is the first branch and the largest branch, profunda brachial artery. This is the second branch, going behind the medial epicondyle, superior ulnar collateral. And this is the third branch, going in front of the medial epicondyle, inferior ulnar collateral. Of course, it gives muscular branches, and it gives a nutrient artery to the humerus. So muscular branches to the muscles of the front of the arm, and the nutrient artery to the humerus, and the 2 terminal branches, radial and ulnar arteries. So branches of the brachial artery. First branch, the largest branch, is the profunda brachial artery. Second branch, superior ulnar collateral. Then inferior ulnar collateral. Muscular branches and the nutrient branch to the humerus, and the 2 terminal branches, ulnar artery and radial artery. The profunda brachial artery, this one, gives ascending branch, which anastomosis with the descending branch of the posterior circumflex humeral artery. This is the anterior circumflex humeral. This is the posterior circumflex humeral. It gives a descending branch, anastomosis with the ascending branch of the profunda. Then the profunda divides into anterior branch and the posterior branch. This anterior branch, anastomosis with the radial recurrent artery from the radial artery, and this posterior branch, anastomosis with the interosseous recurrent artery from the posterior interosseous artery. Superior ulnar collateral artery, going behind the medial epicondyle, anastomosis with the posterior ulnar recurrent. Inferior ulnar collateral divides into anterior branch and posterior branch. Anterior branch, anastomosis with the anterior ulnar recurrent. Posterior branch, anastomosis with the posterior ulnar recurrent. Again, see the arterial trunk. Okay, let us put the landmarks. So this is the lower border of teres major, and this is the neck of the radius. Lower border of teres major. So above is the axillary artery, below is the brachial artery. This is the neck of the radius, okay, where the brachial artery bifurcates into ulnar and radial arteries. This branch is the radial recurrent artery. Ulnar artery gives anterior ulnar recurrent and the posterior ulnar recurrent and the common interosseous. This common interosseous divides into anterior interosseous and the posterior interosseous. This posterior interosseous gives the interosseous recurrent artery. So the first branch, okay, the third branch, third part of the axillary artery gives the posterior circumflexohumeral artery. This posterior circumflexohumeral gives the descending branch. Okay. First branch of the brachial artery is the profunda brachial artery. This profunda brachial artery gives the ascending branch. Anastomosis with the descending branch of the posterior circumflexohumeral artery. Then divides into anterior and posterior branches. Anterior branch with the radial recurrent artery. Posterior branch with the interosseous recurrent artery. Then superior ulnar collateral artery. Anastomosis with the posterior ulnar recurrent. Then inferior ulnar recurrent divides into anterior branch and posterior branch. Anterior branch with the anterior ulnar recurrent. Posterior branch with the posterior ulnar recurrent. Therefore, anastomosis around the elbow joint. We have superior arteries and inferior arteries from above. Anterior branch of the profunda with the radial recurrent artery. Posterior branch of the profunda with the interosseous recurrent artery. These arteries anastomosis around the lateral epicondyle. Then around the medial epicondyle in front. Anterior branch of inferior ulnar collateral with the anterior ulnar recurrent. Behind the medial epicondyle, posterior branch of inferior ulnar collateral with the superior ulnar collateral with the posterior ulnar recurrent artery. Again, anastomosis around the elbow joint. We have anastomosis around the lateral epicondyle and anastomosis around the medial epicondyle. Around the lateral epicondyle, in front, anterior branch of profunda with the radial recurrent artery. Behind the lateral epicondyle, posterior branch of the profunda with the interosseous recurrent. Around the medial epicondyle, in front, anterior branch of inferior ulnar collateral with the anterior ulnar recurrent. Behind, posterior branch of inferior ulnar collateral with the superior ulnar collateral with the posterior ulnar recurrent artery. Again, this is the brachial artery. The first branch is the profunda brachial artery, which is the largest branch. It runs in the spiral groove with the radial nerve. It gives the ascending branch. Anastomosis with the descending branch of the posterior circumflexohumeral. Very nice. Divides into anterior branch and posterior branch. Anterior branch, anastomosis with the radial recurrent artery. Posterior branch, anastomosis with the interosseous recurrent artery. Very nice. Profunda also gives a branch to the humerus and also gives muscular branches to the triceps muscle. Second branch of the brachial artery is the superior ulnar collateral. This superior ulnar collateral, very nice, passes behind the medial epicondyle, anastomosis with the posterior ulnar recurrent artery. Then the third branch, inferior ulnar collateral, divides into anterior branch and posterior branch. Anterior branch, anastomosis with the anterior ulnar recurrent. posterior branch with the posterior ulnar recurrent. Nutrient artery to the humerus and muscular branches. The two terminal branches, radial artery and ulnar artery. Now, where can you feel the pulsation of the brachial artery? Where? Okay, along the medial border of the biceps tendon, medial to the biceps tendon. So where can you feel the pulsation of the brachial artery? Medial to the biceps tendon. This is the profunda brachial artery in the spiral groove with the radial nerve. So the profunda brachial artery is related to the radial nerve in the spiral groove. And thank you very much. Good luck and have a nice day.